Hello all. My name is Umar Marika and I am a part of the COVID-19 research group of the Faculty of Engineering in University of Peradeniya. So our research is basically to model and focus the spread of COVID in some area using artificial intelligence. Artificial intelligence has been widely used throughout the world for uses such as face recognition, autocorrect, text to speech, and so on. Another main use case of artificial intelligence is pandemic modeling, where one tries to model the spread of a disease in space or time. In the case of COVID-19, there have been many studies that have been carried out in the past few months, and these studies have basically helped policymakers make decisions in terms of lockdown measures, hospital resource allocation, and increasing the number of tests in more vulnerable areas. What we want to do is create a predictive model to predict the spread of COVID-19 in both space and time. For example, let's take Colombo and Gampaha. And right now we know that Gampaha has gone through a massive outbreak, and given the outbreak in Gampaha, how severe the outbreak in Colombo is going to be, and that's going to depend on many factors such as how close Colombo is to Gampaha and the socio-economic factors such as population density, uh, the poverty rates, and so on of both Colombo and Gampaha. So we want to incorporate all that to our AI model and obtain future COVID information in that area. So we have collected data from the USA because it is freely available from the Johns Hopkins University database, and we have also considered both statewide spread of COVID-19 and county-wide spread of COVID-19 in the space of Texas. Why we have done this is because the two cases are geographically different. The states are much larger and the counties are much smaller. So that helps us uh, train our models for different kinds of geographies. For our first part, we have developed a model to determine the severity level of COVID in the states of USA. The severity level can be defined as how hard it has hit a specific geographical area. So, as you see in this figure, in our case, New York has the highest severity out of all the states in the USA. And that could be due to many reasons, such as population density and the high poverty rates in that area. So, what we have done is we have used those demographics such as population density, median income, poverty rates, and other and many other demographics to actually predict the severity of a given state. So what happens is when there is no COVID in a state and it is yet to have an outbreak, we could have some kind of idea as to how severe the outbreak will be in that area. This model has also been trained to determine the COVID severity level in the counties of Texas. So even this has a pretty high accuracy. So what we can obtain from it is that our model can be used for both larger and smaller geographical areas. So from our previous AI model, we can also determine the impact of demographics on the severity of COVID in an area. So from this figure, it shows that the population density is very highly impactful towards the severity, and the median income has a negative impact towards the severity. So not only these demographics, we have also used other socioeconomic variables such as racial structure and the level of education in a given area. Incorporating these demographics is going to help increase the accuracy of our predictive models. Another part of our research is to predict the future number of cases using past cases. So in this figure, we can see that we have considered three states from the United States and we have implemented a 10-day prediction. And this prediction accuracy is above 90%, which is sufficient for most cases. Also, this has been implemented for counties in Texas and also is being designed for larger prediction horizons, that is more than 10 days. So our next part is to use the geographic location as a variable as well to obtain the future COVID-19 information. Right now we have developed models to predict the severity using demographics and also to predict the future number of cases using the past number of cases. And we are currently experimenting with various algorithms to find relationships between the location and the spread of COVID in time. What this is going to do is this is going to help complete our predictive model, which takes into account all the three kinds of in data to give future COVID-19 information.